The difference between the standard lenses is that with the standard lenses, it focuses light to that posterior polar, to that macula. The peripheral part is focusing behind the retina, okay? So the thought there is that the retina is trying to try and match that focusing that's happening behind the retina. So they've figured out in different ways with these different lenses to cause what's called peripheral defocus or myopic peripheral defocus. That means that those more peripheral areas are actually being focused in front of the retina, so then the retina doesn't have that drive to get longer and longer and longer. Because as that retina gets longer and longer and longer, to try and match that defocus that typically happens with standard lenses, that eye gets more and more nearsighted. So when you look at the different studies that have been done in terms of the research that's gone into myopia control, the downside is a lot of the demographics for these studies are between like, 6 and 12, 6 and 15, 6 and 18, right? They just don't tend to push any of these into adult studies. Myopia does tend to change a lot later in life than what we expect. Like oftentimes we see patients coming in up to about age 30 with moderate myopia where it continues, that number continues to grow, right? So although the research isn't there, you could potentially do some type of off-label use and have fit an adult in one of these myopia control lenses. It's just the downside is we don't have the data to essentially support doing that for everybody, right? But again, that's where patient education comes in, and you can have a conversation with your optometrist. Maybe that's something you guys can look at if you've seen that prescription changes quite quickly.